My name is Katie Van. I am the lab assistant videoing Ruben. Today is the September 25th and it's 11:30.
I, Barnabas Katema, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as part of the Nursing 210 Adult Health Assessment and Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secure YouTube site viewable by the nursing students and the instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent.
Hi, my name is Ruben Carlos, student nurse here. And your date of birth?
December 4, 1994.
Awesome. So today we're going to assess your ears, mouth, and nose. Just starting with the ears, I can see that the helix on both sides are symmetrical. They are in the same level with the eyebrows, or the outer portion of the eyebrows, and just barely above the outer canthus of the eye. I can, upon palpation, is there any tenderness?
Mm-hmm.
So there's no tenderness on the helix, triangular fossa, the concha, tragus, antitragus, and the lobules. So no tenderness there. I'm just going to take a look inside your ear. Okay. If you could tilt your head a little bit to the side. Perfect. Okay, so upon inspection, I can see just a little bit of cerumen. I didn't get to get a good look of the tympanic membrane, but one would expect to find the tympanic membrane to be pearly gray. The malleus in the midline of the tympanic membrane with the pars tensa on the lower left. Since this is right here, you would see the cone of light going on the 5 o'clock direction. The pars flaccida would be at the superior portion, just right above the malleus and the handle of the malleus. And the umbo, right inferior, in the inferior aspect of the malleus. And was there any tenderness when I inspected your inner ear? Awesome. I didn't see any arrhythmia, no bulging of the tympanic membrane, no perforation as well. And you would do this bilaterally. I'm just going to assess the hearing. This is bone conduction, bone lateralization conduction. And so tell me if you can hear this equally in both ears.
Mm-hmm.
Awesome. And for the Ryan's test, I'm going to assess bone conduction versus airway conduction, and it's going to be right under the mastoid. Okay. So whenever you don't hear it, just let me know, and I'll switch. Okay. Awesome. So it was normal findings at a 2 to 1 ratio. Airway conduction is a lot longer than the bone. I'm just going to do the whisper test now, so if you can include one ear. And I will do the Ryan's test bilaterally as well as this whisper test. So if you could just verbalize what I say.
Soccer, baseball, basketball.
Awesome. So I was just assessing for all three of those tests the cranial nerve 8. Next we're going to inspect the nose. So if you could just go ahead and look up. And before I palpate, just upon inspection, the skin on the nose is symmetrical with the rest of the body. It is consistent. It is midline. I see that there is no trauma. Just upon inspection outside, I can see that the nares are symmetrical. He has primary lesions on the side, 2 nevis, and I'm just going to go ahead and look. So the lining of the nose, the mucosa is moist. It's not red. It's pink, and that's the normal findings. I see no perforations or no deviation of the septum. The septum is midline. There's no, like I said, the nares are symmetrical. And if you can actually occlude one of your nares and breathe in. Okay, and go ahead and do it with the other one. Awesome. So both airway passages for the nares are open. And I'm going to ask you if you can just close your eyes and identify the smell and occlude one of your nares.
Vanilla.
Okay. Go ahead and switch.
Cinnamon.
Awesome. So that was assessing cranial nerve 1 olfactory, and seems to be normal findings. Last but not least is the mouth. If you can smile. Awesome. So I see that upon inspection, his lips are darker because of the pigmentation of the skin. There's no signs of colitis or chelosis, which would indicate nutritional deficiency or poor hydration. They look smooth. They're dark pink, almost purple, and his teeth are opaque white. Just upon inspection, I can see the inferior frenulum, the superior, and if you can open your mouth and then stick your tongue up, touching the roof of your mouth, I can see his Wharton's ducts as well as the sublingual frenulum. Just gonna ask you if you can say ah, and stick your tongue out. Okay. And his tongue is pink. This is a good indication of good nutrition. And if you can stick your tongue out and move them side to side. Okay, so it appears to be smooth. There's no lesions on the tongue. The buccal mucosa is pink. I can see that there is one lesion on his right side of the cheek. And is that from biting your cheek? Did you bite your cheek? Okay, and that's actually really close to the Stenson ducts, just right below it. Stenson ducts is located lateral to the back molars. If you could also say ah again. And stick your tongue out. Go ahead and look up. I can see his tonsils. He still has his tonsils. There is no occlusion of the tonsils. His uvula is midline. Also, I'm just going to count your teeth. Okay, so he has 30 teeth. This is a normal findings for an adult male. I'm also going to have to ask you to open your mouth as well. The hard palate is rugated and is consistent. It is continuous with the soft palate. When I was assessing him for him sticking his tongue out, that was testing hypoglossal cranial nerve 12. And when he was saying ah, that was also assessing cranial nerves 9 and 10. This is the rising and falling of the uvula that is normally in midline, right in front of the posterior pharynx. This is also speech and the gagging reflex. And my patient seems to be in healthy condition, so I'm done.